So I was really excited to be presented with the option of being able to talk about the needs of the acute care patient in regards to pain and the way that advanced practice providers, nurse practitioners, physician assistants, clinical nurse specialists, the role that they take. As we see, for a lot of reasons, the increase in patients, also the complexity of needs for pain management. We see a lot more NPs, PAs, and advanced practice nurses working with these patients as primary practitioners in collaboration with other physicians on their team. And so because we've seen so many of these advanced practice providers in the acute care setting, the need for education has quadrupled. So not only do we see advanced practice providers now in the acute care setting solely working in surgery, we see them in psychiatry, we see them in oncology, we see them working in the anesthesia pre-op clinics, we see our CRNA colleagues administering anesthesia and being part of the whole perioperative pain process. Well, I think that PAINWeek has always been receptive and accepting of the needs of advanced practice nurses as well as PAs in terms of education about pain and incorporated them as kind of all the treatment team. I think we formalized it this year with the AAPP track. We work together. I think one of the key takeaways is collaborative practice in terms of pain management. When we focus mostly on multimodal management of patient, interdisciplinary management of patients, the importance of the behavioral management focus, our mental health colleagues, the pharmacists, the nurse practitioners and the PAs are part of that mix. One unique aspect that nursing brings to the role is that they have that history of patient engagement. Not that other pain providers or other practitioners do not, but I think nurses have been trained from early on to listen to the patient and to focus on their needs from a global perspective as opposed to just looking them unidimensionally. So I think I think we work collaboratively, but I think nursing in particular, advanced practice nurses bring that to their practice as an adjuvant to treatment. I think that we really work together as a team, and I think that trust that the primary physician, be it in specialty practice or in primary care, can essentially expand their bandwidth of their treatment and their collaborative and trusting relationship that they develop with their advanced practice provider, be it a nurse practitioner or a physician assistant or what have you, is so important in terms of presenting a common goal to the patient. So I think having the patient understand really that there's the team approach allows the care to be engaged in a more kind of thoughtful, comprehensive manner. So I don't want to so much lead you to believe that there's a differentiation in care. I mean, we all kind of collaborate together. So there's really not that hierarchy if you're interacting with physicians in the acute care setting or physicians in the clinic setting, but to understand, to really engage the patient's understanding about how we work as a team. And there's a multidisciplinary team with the unilateral focus in terms of good patient management. So HCAHPS is very interesting. So it really looks at more the acute care setting. And so HCAHPS is a independent survey of patient satisfaction with their care. And a big part of that patient satisfaction is looking at their pain management. So the pros of it is that it really, it makes us as healthcare providers accountable to engage the patient in terms of their treatment, to listen to the patient and make sure that we are on the same page in terms of what the goals of treatment are. So that's the positive to it. The negative to it is it's really, I think, directed practice, allows the patient direct the practice to maybe where is not best for them to be. And to elaborate on that, one of the things that has been brought out in the literature of late is not only this importance of patient satisfaction, but how practice has changed to, and specifically prescribing of opiates, to get those good HCAHPS scores and to make the patient satisfied in a way of essentially buying their satisfaction, if that makes sense. And whether you agree with the HCAHPS or not, I think that the premise of it is good, and the good is the engagement of the patient and making sure that we're paying attention to what their psychological, behavioral, and spiritual needs are. The not so good of it is that in some situations it's guided practice to possibly the detriment of the patient.